So the kind of elephant in the room is COVID, and the way COVID and the health service has changed over the last 3 or 4 years. What I would say is that we're doing a lot less bariatric surgeries now than we were before COVID. And there's reasons for that. Because you've got a kind of backlog of category 1 surgeries for people with cancers, for hip replacements, they've been getting priority over other very essential surgeries, but not quite as kind of life-changing surgeries. And that's meant that we as a service have been able to do less bariatric surgeries than we would like. It's kind of hard for the patients. It's hard for us. But in general, what would happen is you would have a BMI of about 35 to 40 for the kind of priority 1 categorization, a recent diagnosis of type 2 diabetes. You would be referred to us, and we kind of take it on a case-by-case basis. There are prioritization rules for what you can and can't do, and just now it's just priority 1 for ourselves in Grampian.
That's what I really liked about your voice messages. You went through, like, sometimes they get sent to dietitians, sometimes they get sent to different psychologists and stuff. Yeah.
So, and basically based on what we see, part of the assessment process leading up is that, okay, are you suitable for the surgery? What have you tried before to lose weight? Because really we're looking for people, sometimes our patients have lost quite a lot of weight already and then they've regained it. So we're looking for people who've tried, they've already made an effort. We're kind of looking for a commitment to process that they can change. Things that are contraindications or things that might mean that you probably are less likely to be successful from the surgery and therefore like we be less inclined to do it would be things like if you had an eating disorder, if you had an active psychiatric like sort of disorder, schizophrenia, whatever, if you lacked capacity. So what we mean by that is
that so that if you were to do the surgery, like that would cause other complications if they did have an eating disorder? Or
yeah, the eating disorder one, that's a whole other kind of thing, because there's really where does the line end between binge eating and an actual eating disorder?
I think that's a lot to do with all mental health issues, isn't it? It's very like, do you hit this criteria? And then that can be vague as well.
What I'd say is that, like, so if you were like, if you were severely depressed, if you'd been suicidal or tried to commit suicide within the last 2 years, if you were floridly psychotic, these would be all reasons, obviously, not to do the surgery, and for a lot of surgeries as well, not just ourselves. Being depressed is quite common amongst the patients that we see for surgery. And that's not an absolute contraindication, like an absolute no-no, basically. And then in terms of binge eating, like, we explore that quite carefully to see like what's someone's eating patterns.
Okay. So I want to cover as much as possible. I want to cover positives and negatives sort of as well, but we'll maybe go through the positives. So I've seen quite a lot of good stories about it. I was watching one that, like, see the American ones, sometimes they're a bit far-fetched, and because I'd been watching the personal trainer and he was too far the other way, and then I watched this one that was like, oh, it's the best thing that's ever happened, and then they were getting him to run up the stairs after, and I was like, look, you can run up the stairs, and I was like, oh my god, this is too much. Then I realised I had YouTube on 1.25 speed. He was just walking up. It was actually just showing him the guy was just swinging a golf club and just walking up, and I was like, actually, that's absolutely fine. That's fine. So what would you say, like, are the main positives to this, and like maybe the biggest misconceptions?
I guess the biggest misconception is that it's an easy process. It has a lot of evidence behind it, and it's very good for weight loss, but it's not a process that's particularly easy. There's a lot that goes into it and getting patients ready. The surgery has risks and benefits. If you have bariatric surgery and you lose the expected amount of weight, it can literally be life-changing. You can have type 2 diabetes before the surgery, that's in remission, and if you track outcomes of, say, mortality.
Can you explain what that means, remission for diabetes? I understand it, but I would also quite like a clarification again.
Sure. So, there's different types of diabetes. The kind of one that we are talking about is where your body becomes very resistant to insulin, which is a hormone messenger, and that basically tells cells to take glucose in. And as a result, blood glucose is much higher in your kind of body. It has got all kinds of effects. It's that shear and force in your kidneys, it's hard in your eyes, your risk factors for cardiovascular disease increase. and we know that that's linked with kind of body weight getting higher. So, and as you get, as time progresses, and if your blood sugar control is very poor, you're at risk of kind of heart attacks, amputations. There's all kind of comorbidities with that. And yet, one of the biggest ways you can treat that is by losing weight. And you don't want to say you cure it, because it can come back if you regain the weight. But certainly you can put it in remission.
Yeah, okay. So you've found that the surgeries tend to be in the long term as well, tend to be the most effective for weight loss. I couldn't find much studies that were like 10 years plus, if you know what I mean.
Yeah. I mean, certainly, I think the Swedish studies are, I think they're certainly 10 years plus. Yeah, I mean, for sure that patients who, I mean, if you compare bariatric surgery to controls or patients that try other interventions, the numbers are stark. Like, it's just a much, much higher weight loss over that period of time. I mean, you run into kind of risks as you get older. Depending on the type of surgery you've had, if you've had, say, just a kind of mechanical change like a pouch where the weight loss might be a bit less, you're less prone to kind of malabsorption. But if you have one of the procedures where you sort of malabsorb as well, like a Roux-en-Y, then you have to, you're at risk of things like fractures and that kind of thing as you get older if you don't take your supplementation.
Okay.
So,
what I was most interested in is, so if you look at, hard to really tell with like people just being overweight. So sometimes that's just like lifestyle has changed, that sort of thing. Then there gets to, obviously that's who knows where that line is, where it gets to the point where it's not that, or there's health complications and stuff. Like you said, I think you have to take it case by case, don't you? If you look at like morbid obesity and some people like get offended when you maybe say things like this, so you have to tread carefully the way you say it. You are looking at maybe using food as more of an addiction, like a coping mechanism. Have you found struggles when people have had the sleeve, when they now, because effectively what I heard was they can't really absorb the same amount of food. So they then, do you ever find that they have to find something else to cope with?
So you're talking about addiction transfer. I mean,
that is the better way to say it.
I mean, I think the evidence is fairly, I think there's debate about addiction transfer. Anecdotally, I think we've seen it, it happens. But really, one of the reasons why, I mean, pre-COVID, if you were to come to us, the procedure could be between meeting you for the first time to getting you through all the kind of preparatory classes, all the assessments. So I would say, yes, you're perfect for the pathway. You would then meet the dietitian, you'd meet the psychologist, you'd meet the surgeons. The dietitians and the psychologists would do really kind of intensive work with you to get you ready. And what they're trying to do is they're trying to correct some of those potential issues that you already have.
How long will that period last? So you're talking before the surgery?
Yeah, so that could be, I'm not actually sure because it's not part of the part of the pathway that I'm working in, but it's several months. It used to be several months, and it was like, I think now it's online classes post-COVID. It used to be kind of in the classroom, as it were, in the hospital.
Oh, really?
But yeah, it's quite intensive, and the dietitians really step up to the front. They're one of the mainstays of our service, and they're working at just kind of, talking about cooking, correct eating patterns, trying to, avoid kind of some of the pitfalls that people fall into.
I like you told me on the voice, because you'd sent me about 10 minutes worth of voice messages.
Yeah, sorry about that.
I was shopping when you done that, and I was like, I listened to like 10 seconds of one. I was like, this guy sent me far too much. And then you started speaking, and I was like, this is actually really interesting.
Sorry about that, man.
And then I went back and listened to him. I was like, I need to get this guy on. But with the education on cooking, that was one thing you mentioned in the voice message, and I think people don't realise as well, because that's help that people need a lot. And the fact that you offer that, because I think people think, oh, they just get this sleeve and then that's it, and then they've took the easy way out as well, a lot of people say, and they get no support. So even the pre-support, that's extensive, and that sounds like quite a lot.